Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Thumb sucking. Thumb sucking is often a source of pleasure in young children. It is Thumb sucking may be persistent in the older children also. Thumb sucking in older children states that it is a considerable sign of insecurity. Normally, the thumb sucking disappears by 4 years of age, and if it persists after 4 years of age, then the child may present with malalignment of teeth. To prevent this adverse effect of dentition, thumb sucking should be discontinued by 8 years of age.
Should be discontinued by 4 years of age.
thank you and thank you for watching.